Hello, welcome to Wellbeing. I'm Guy Murphy. Today my guest is Stevie Amos Burke, a researcher and writer whose work explores grief, emotional regulation, and human resilience. He is the creator of the R.E.A.L framework, an education-safe, non-clinical model that helps people process emotion and make clearer decisions under pressure. His research bridges psychology, neuroscience, and lived experience to make complex ideas practical and accessible. Thank you for joining me on the show today, Stevie.
Thanks for having me, Guy.
Not a problem.
How are you doing today?
Good, thank you, and how are you?
I'm doing fantastic. I want to say first and foremost, thanks for this opportunity. Grief is something I'm definitely passionate about, so I'm ready to go.
Not a problem. Well, it's a very interesting topic, so without further ado, let's get into the questions. So, first off, what got you into working in the field of grief?
I came to the work of grief through my own experience. Back in 2016, I checked myself into rehab, and while in rehab, I spent some time talking to the priest who was part of the program. He asked me, "Why are you here?" And I had to sit and think for a little. But my response was, "I'm here because I lost the one person I could talk to, my brother." He said, "He's not gone. I want you to go back to your room and write your brother a letter. Write him about things that he's missed. Write about things that you miss about him. Write whatever you want. But after you're done with the letter, I want you to bring it back to me." I went back to my room. I sat at the window and I started writing. 2 lines in, I wrote, "Dear Julian," and then I started crying. At the time, I hadn't cried in 15 years. I didn't even cry when my brother passed away. Crying for the first time in a long time felt like a dam broke, and the tears filled in the cracks that was once a desert in my heart. It felt like it reconnected my mind, body, and soul. For years, I suppressed all my emotions that would make me cry. I avoided feeling grief, whether it was a loss of a loved one, friends, family, relationships, or even the goals I failed to complete. I avoided all those emotions. Suppressing or avoiding grief led to poor decision-making. However, the practice of writing a letter intrigued me. And since 2016, I've been researching different ways to process grief, and I've published a few papers on the topic. Grief is a big emotion filled with so many other small emotions. Every day we're in a state of grief. We grieve people we lost, jobs we didn't get, money we lost, things we didn't say, events we missed, or even the parts of us that we feel disconnected from. So yeah, I've been in this since 2016, just doing the work.
Wow. Yeah, that's a really powerful story. It seems like, you have some lived experience there.
I would definitely say so. I think when we make the commitment to actually sit with our feelings and emotions, we benefit a lot from it.
Absolutely. Now, just to get into your study, which is the science and experience of grief, psychological, neuroscientific, and cultural perspectives. In this paper, and theoretically, how do we distinguish between adaptive grief and grief that negatively impacts long-term well-being? Or in other words, at what point does grief become detrimental rather than a normal response?
Okay. First, I'll tell you the difference between adaptive and harmful. Well, adaptive grief usually comes in waves, right? It changes over time, and it allows moments for meaning, connection, and even joy. It doesn't require us to abandon ourselves or to survive it, right? When grief becomes harmful is when it actually freezes our identity. We'll say things like, "This just is who I am," right? We identify with this state of mind that it's almost like a shock, right? It also collapses the future, and it hijacks our behavior. We'll avoid, shut down, we go into rage or numb ourselves. Well, in short, if grief narrows your life instead of molds it, then you know something is stuck. And if something is stuck, you have to figure out why it's stuck.
I like that answer. That when grief molds you rather than freezes you, it's adaptive. Would you say that that's a good summary?
Yes, definitely, because the thing about grief is that I'm pretty sure I'm going to touch on this a lot. We always think that grief is something that we have to get rid of. But grief is there because we lost something that we loved,
Yeah.
right? And there's a deep connection to it. So we just need to understand it.
Yeah. And you mentioned as well, it's related to identity. I actually had a guest on last episode to talk about grief as well. And part of his research was about the ego, how grief related to the ego. So it's interesting that you mentioned that it's an identity thing.
Yes, definitely. As far as identifying with our feelings and emotions, if we don't understand what we're identifying with or we're afraid of it, then sometimes we use the ego to separate who we are from what we're actually feeling. Yeah.
Interesting. And moving on, so which psychological processes in grief, such as rumination, avoidance, or emotional suppression, are most strongly linked to declines in well-being, and why?
Well, I believe like avoidance and emotional suppression like pretty much go like hand in hand, right? Because what we avoid, we're actually suppressing, and anything that we suppress, because the body keeps score, it shows up later on as fatigue, pain, anxiety, or some kind of like illness, right? Grief needs to move. So if we're in any state of avoidance and suppression, right, grief isn't moving at all, right? We're staying away from the thing that we think is going to be painful, but it's actually the total opposite. When we avoid grief, it then becomes painful later on in life.
Yep.
Because, of course, it could also lead you to addictions, where it's alcohol, drugs, food, excessive working out, that kind of stuff. So,
absolutely. So would you say that they all kind of go hand in hand and, are all equally detrimental to well-being, or is there one that's worse than others?
Yes, standing out like by far is suppression.
Okay, emotional suppression.
Yeah.
Okay, interesting. And in your review, which coping practices like journaling, CBT, and breathwork appear to offer the strongest evidence for improving overall well-being?
Actually, it's a combination of journaling, breathwork, somatic awareness, grounding, because when we breathe into what we're feeling, we sometimes get a clear or better understanding of how we're feeling. With all we have to do is actually just slow down. And after we go through the process of feeling, journaling actually is another great tool to now integrate a little bit more into our life, right? When we talk about feelings and emotions, if it's something that we do not understand, the only way for us to understand it is to constantly go into it, as in we're always in our nervous system saying, okay, why am I feeling like this, right? Because at the end of the day, if we don't understand how we feel, we can't communicate how we feel as well, too.
Yeah, fantastic. Funny you should say that, because again, in that last episode, from memory, the study that we were looking at, they found that, I think it was a meta-analysis. Yours was a meta-analysis as well, was it not? Correct me if I'm wrong there.
Yes, it was.
Okay. But yeah, so this other one was a meta-analysis as well, and I think they found that journaling was pretty much the most helpful thing that you can do. Do you think that that's related to, we just talked about emotional suppression being one of the worst, in terms of outcomes for well-being. Do you think that journaling is helpful because it is kind of almost the opposite of emotional suppression, emotional embrace and, awareness, self-awareness?
Yes, by far, because one thing about journaling is just you, a pen and a piece of paper. Structured journaling actually helps out a whole lot more because it gives you a guide to lead you where you quite possibly may need to go. But when you sit down with a pen and a piece of paper, you're in a judgment-free zone. There's no one to judge you, so there's no one holding back. And I believe when there's no one holding you back or no thoughts or whatever the case may be, you allow yourself to truly express how you're feeling or what you're grieving about.
Absolutely. I suppose it's just unfettered, unfiltered emotional processing, really.
Yeah.
Very interesting. And based on your review, what daily routines or practices would you recommend to someone early in their grief who wants to preserve their well-being?
I would definitely say don't do anything extreme, nothing performative, right? Usually, when you check with your body, you do a body check-in per day. You say, what am I actually feeling right now? It's just one simple question you ask yourself, right? And you could say, where am I feeling this in my body? Is it in my chest, my shoulders, my foot, my toes? And I believe as well, too, if you stay on your routine, such as like your shower, you go for walks, you're eating, the normal things, right? The normal things keep you within this timeline. Also, allowing yourself to grieve when it comes up. You could also journal, as I mentioned before. You could pray. You could use voice notes, or you could quit, like doing something, right? For me, when one of my family members or a friend passed away, I would take a moment and just say, you know what, I'm going to block off 2 hours and just sit with myself. And I believe just sitting with yourself or sitting with a loved one or whatever the case may be, it helps a lot. And nature works as well too, music, movement, sunlight, all these things. Like, it's not just one thing you want to do. You want to do multiple things, because when you look at grief, especially if it's grieving the loss of a loved one, like, let's say, for instance, I'll use my brother as an example. We used to listen to music a lot. So when a song comes on out of nowhere, I'll just be like missing this person that was here, right? So music has this deep connection with memory. It also has a deep connection with people that were lost. So it's more of like getting a clear understanding of who the person is, like, grieving. So if you're the type of person that you get a release or you feel relaxed when you listen to music or when you go for a walk, these are things you always want to do when you're in a state of grief or early grief.
Absolutely. It sounds like, from what you're saying, that there's almost a meditative component there, something related to mindfulness, getting out and walking around, just being present and in the moment. Do you think that this is related to mindfulness, and do you think that that could help with grief as well?
Yes, definitely. When you consider that we are humans and we are mind, body, soul, right? The more we do for our mind, our body, and our soul, it definitely makes sense. And mindfulness, I believe, is definitely a great tool as well to process feelings and emotions. It keeps you in a present moment.
Yeah, interesting. Okay. Are there any interventions you were surprised to find effective for well-being that are currently under-recognized in clinical practice?
Yes, micro practices, right? The little small things that we do to not avoid feeling anything. When we do it in repetition, we're teaching our nervous system that it's okay to feel, right? And it's okay to grieve. Because sometimes when we're in a state of grief, the outside world don't understand what we're going through. Only we understand what we're going through. So it's okay to label your emotions when you're feeling it, to do some kind of somatic tracking as well too. These things are like very good to actually feel into your body, because grief is stored in the heart the majority of times, right? If you do some kind of heart-centered breath work as well, that definitely helps as being part of the micro practices.
You're listening to Wellbeing. My guest today is multidisciplinary researcher and creator of the R.E.A.L framework, Stevie Amos Burke. What other kinds of micro practices are there?
I mentioned that I was working on a framework before. It's called R.E.A.L. And with the R.E.A.L framework, what it does is just a series of questions that you ask yourself whenever you start feeling a feeling which is overwhelming, or you have a feeling that you don't actually understand. All you're doing is just asking yourself a bunch of questions. So when after you ask yourself these questions now and answer them honestly and truthfully, then you could get a full understanding, a better understanding of what you're going through. if you understand what you're going through, then you can make better life decisions. You can make better decisions going forward.
It seems like there's definitely a theme of confronting feelings and having emotional awareness. You've mentioned a couple of times now that, like running from grief or suppressing it can actually lead to more. It's just interesting that maybe the best method of confronting grief is to do it head on and really properly confront it with everything you've got.
Yes, definitely. I'm a firm believer that we don't have to be impatient with ourselves, but we do have to be persistent with ourselves, right? Let's say, for instance, 9 times out of 10, you're dealing with the grief like head on, then you have a better chance of improving your quality of life. If 5 out of 10 times you attack it head on, right, then of course your quality of life is going to be a little lower. So it all depends on how you want to attack whatever you're going through, or you want to process or feel whatever word you resonate with in there. Well, you have to get to that point where you just say, okay, this is how I feel. Let me find out why I'm feeling this way, and let me not let what I'm feeling right now dictate how I make decisions in my life.
So you mentioned, whatever works for people, whatever resonates with them, that's what they have to approach. If you wouldn't mind please explaining for us, how does grief work on the individual level and also on the cultural level? How do cultural differences and individual differences come into processing grief?
On an individual level, it's more so like we have to understand that, yes, feelings and emotions that we have as humans are like practical. If you feel pain, it's the same way I feel pain. The magnitude of how fast we process the pain might be totally different. I might be more resilient than you are to that pain, but it's still pain, right? And even though we could have the same way of processing pain, you might process it faster than I would. So I believe that when we understand who we are individually, we now gravitate to what makes sense to us, but it's all within the same framework of how we heal, right? You may connect to music a whole lot faster than I can, or you might be able to relate to a song that helps you process something a whole lot faster, or you might be able to go draw or write a poem or whatever the case may be, or write a song in order to help you process grief. That's what I mean by we all have different ways of doing the emotional work. It doesn't have to be the same, right? There's so many tools out here for us to actually find something that could help us get to where we need to go a whole lot faster. It's just that we have all these blockages in front of us. Now, when we go into the cultural aspect of it, like so many different cultures respond and they process grief a whole lot more different. When you go to like Native American tribe, or let's say, for instance, I'm from the Caribbean, the way we deal with grief is so much more different, right? There's a party and a celebration, right? Let's say my uncle passed away 2 years ago. Well, they partied, right? There was a wake going on, a party going on for maybe like 3 days because he was a musician. It all depends, too, of who the person was that you're grieving. I believe when we understand how different cultures like celebrate grief, we could also see if some of these things that different cultures do work for us, right? We don't just have to say, okay, I'm Jewish, I'm not going to celebrate or process grief the way Native Americans process grief. There might be something in there, you never know, might work for you. Right. So at the end of the day, we have to find things that will help us be within this conscious body that is our body. Right. And when we process our feelings and emotions, we live in this now, this real time. Right. We are healthier when we are not suppressing anything at all. I could say, hey, Guy, what you said about my grandma made me feel like a type of way, right? I could sit and talk to you about that because I'm not suppressing anything at all.
Yeah, interesting. I love that you have this idea of trying new things and trying whatever works for people regardless of whether it's, culturally normative or not. I think that's a great idea.
Yeah, it
Um,
definitely is because we have all these tools, but we just don't know like what tool works for us.
yeah. No, I think that's a great way of looking at grief and approaching the healing process. And moving on, how should clinicians balance emotional processing of grief with maintaining everyday functioning and well-being?
I believe that when we stop treating it as opposites, because function without processing leads to collapse later, processing without structure leads to overwhelm. It definitely needs a balance, right? Short containers of emotional work, followed by grounding and return to life. When we repeat this once again, we're training our nervous system to do something other than run. We're training our nervous system to understand what we're going through and not evade or avoid what we're going through. So we don't need extra anything. We need just a system that we could do over and over and over and over again.
Right, okay, just a system of repetition and doing those simple things.
Yes.
Your article touches on AI and digital platforms in grief management. What are the well-being risks and benefits of these tools?
Well, one of the greatest benefits of AI, of course, is accessibility. Right, at the touch of our fingers, we could get a second opinion about anything. Right, it's consistent, is non-judgmental and reflective, and it also gives you a line of support in between, like therapy sessions or grief sessions, or support on top of your support. Well, the risk is we tend to avoid human connection if we go too far into AI and computers, right? We cannot disconnect from humanity. And I believe the more AI we use, if we don't understand that we also have to have a balance with humanity as well, too, we'll get too far in. Well, you just simply see people talking to AI and not confining into like community support and all that stuff. Because AI should never replace emotional support, and it should definitely never replace the relationship between friends and family as well, too. It should simply just be for emotional literacy.
Absolutely. And what misconception about grief and well-being do you most wish the public or clinicians would let go of?
Oh, I actually like this question because healing isn't something that you get over. And for years, I've been hearing either get over it or I'm healed. And grief isn't something that it's finished. It's something that you learn to carry differently. If you're still grieving and someone says to you, you're still on that, then you know right there and then that's not the kind of person you want in your environment, right? You want people that is going to support you. I believe that there's a big difference in between safety and support, because safety allows you to be whoever you want, whenever you want. Support actually challenges you in there to actually feel and express and do all that kind of stuff. So support definitely works for me. But once again, if anyone says to you, get over it or you should move on, that's kind of people you want to stay away from.
Absolutely. So just to recap on that, grief is something that you never truly heal from. Is that the take home message there?
Yeah, grief is something you understand. There's no healing from grief because you can't get away from or move away from things that you loved. Like, why would you want to do that? You want to save that memory in your heart.
Yeah.
Right? You don't want to let go of those memories. You want to keep them because that's the only way we'll have to remember like things or people from the past or whatever the case might be. As far as like not getting a job and that kind of stuff, then I think that's easier. That's a whole lot easier to process. It's still a loss, but jobs come and go, but people sure don't.
That's absolutely right. And in your view, what does it mean to heal from grief in a way that sustains well-being, even when grief may never fully disappear?
Yeah. Healing doesn't mean the grief disappears. It means grief no longer runs your nervous system. It doesn't dictate your identity. It doesn't block connection, purpose, or growth. And it becomes part of your wisdom. It is not a wound. Sustaining well-being is when grief has a place and it's not driving the vessel call you. It's just there with you enjoying life.
Yeah. Okay. And we're nearly running out of time, but I just wanted to finish up with one final question. I just wanted to touch on the physical side of grief, just because, there's been in a couple of the things that we've gone over, you've mentioned the nervous system and its involvement in grief. Are there any particular techniques that we haven't covered that sort of address that side of grief and that side of the effects of grief?
I would say we pretty much touched on like all of it. Like, let's say, for instance, the body does record feelings and emotions or whatever the case may be. So if you're in a state of grief, it's in your body. So what you have to understand is that the more breath work and somatic work you do in combination with the journaling, with walking, getting sunlight, eating healthy stuff, exercising, yoga, all these things, they help you be in alignment consciously. And when you're online consciously, you're living a healthier life. And I believe when we are in this place called now, right, then 47-year-old Stevie is answering you. When we're not in the conscious state of mind, then 12-year-old Stevie might answer you. And I don't want 12-year-old Stevie online right now. I need 47-year-old Stevie. So I have to consciously make sure I'm doing these little small things each and every single day to live a healthy life. And when you look at the things that I'm actually doing, they're very small, right? It's nothing drastic. So I don't feel like overwhelmed at all any time of the day, right? If I need a break, I need to step away for 5 minutes. I first have to understand why I need a break. And when we breathe as well, too, breathing, I believe, is a gateway to all our feelings and emotions, to a better life, a healthier life. So breathe into it, feel into it, and you'll enjoy it.
I really like your philosophy. It's nice.
Thank you.
Not a problem. My guest today was Stevie Amos Burke. Thank you again for joining us on the show, Stevie. It was very illuminating to have you on. And thank you for listening. I'm Guy Murphy, and all of us at Wellbeing wish you well.
Thank you. Thanks for having me. Have a great day.
Thank you very much, Stevie. Same to you.